With COVID-19 under control in South Africa, health workers are putting the spotlight back on the country's first pandemic, HIV. The community of Soshanguve, north of Pretoria, is considered a hotspot for the disease. This mobile clinic is attempting to fill gaps in HIV services while targeting the most vulnerable populations, women and girls.
It's easy for them to get HIV because of, first of all, the boys, they don't want to condomize. So if a lady depends on a guy, financial or anyhow, then it's easy for them to allow the guy not to use a condom. They are also at risk of getting raped. They are also at risk of getting married at a very young age.
But reaching people wasn't as easy during COVID-19 lockdowns.
There were difficulties in terms of reaching our target because everyone was indoors, everyone is home, people, they were losing their jobs, so there was a high risk of poverty. Obvious, when people are at home, all they do is intercourse.
The United Nations says for the first time in the history of fighting HIV, there were significant declines in testing and treatment for HIV amid the coronavirus pandemic. It means people are at greater risk of unknowingly spreading the disease. Health workers say it's too early to quantify any increases in HIV spread. But they say factors like increases in teen pregnancy, gender-based violence, and school dropouts are cause for concern.
I'm worried about HIV rising again because of COVID, I'm worried about poverty going up. I'm worried about a whole lot of things, unemployment, because COVID has affected our lives in so many aspects.
The setback could reverse years of progress and cost lives.
UNAIDS predicts that the world could face 7.7 million deaths, AIDS deaths, over the next 10 years. And 4.7 million of those deaths will occur in Africa. If we make the needed investments and achieve the 2025 targets, we could save the lives of 2.7 million people.
Despite the economic impact of COVID-19, Eva Kiwango says many international groups like the Global Fund have upheld HIV funding, allowing countries to continue pursuing targets.
South Africa has shown very strong efforts, and communities have been so resilient. We've seen initiatives that have been scaled up.
By reinvigorating efforts, she says HIV can become a disease of the past. Linda Giftash for VOA News, Johannesburg.